Now we start scanning by using the linear probe, placing at right iliac region. Here we see the smallest intestine with gases as echogenic lining. Here we see the fluid with gases and food particles. Now we continue scanning from distal ileum to the cecum. The walls of small intestines are not visualized and are normal. Now the small intestine is continuous with the cecum. Here we also see gases, but the walls of cecums are prominent, are seen hypoechoic line and internal echogenic line. The hypoechoic lining in the walls of intestines are muscle layers, and these echogenic linings are submucosal layer, which are normally not visualized, but when there is inflammation they become thickened and visualized. Here we see the lymph nodes present around the large intestine or ascending colon, which are enlarged in size, and they are only visible when there is inflammation. These are mesenteric lymph nodes. It seems like there is also a inflammation in the mesenteric tissues around the gut loop or intestine. Now we continue scanning from the right iliac region to the right hypochondrium along the ascending colon. Here we see the submucosal layer of ascending colon is more prominent and thickened. Now when we sliding the probe at lateral side of the ascending colon, we see a heterogeneous mass at right iliac region anterior to the right iliac crest or at the middle part of the ascending colon. This mass is attached with the right lateral wall of the ascending colon. Here we see the thick Debenez collection around the mass. This mass has central hypoechoic structure and surrounded by echogenic structure, and also seems like a collection around this mass. And also we see a echogenic area surrounding the mass due to inflammation. Now we measure the size of this mass. The size of this mass is 57 into 35 millimeters. Now when we scanning the surrounding tissue of this mass, here we see the lumen of appendix which attach with this mass. The appendix is poorly visualized due to gases in the gut and inflammation of surrounding tissues. Now it is prominent at other site. Here we also see the enlarged lymph node. Now we will measure the size of appendix. The anterior posterior diameter of appendix is 12.4 millimeter. It means the appendix is inflamed and thickened. The normal diameter of appendix is up to 6 millimeter. It means this mass is developed at the end of appendix due to inflammation. Now how we will write report.